Have you ever pondered on how the field of substance abuse treatment has transformed over the years? Let's take a fascinating journey back in time to observe the evolution of substance abuse treatment over the last 3 decades. In the early 90s, substance abuse was often seen as a moral failing, a lack of willpower. Individuals grappling with addiction were stigmatized and marginalized. Treatment was often punitive, focusing more on punishment than recovery. But as we moved through the decade, a paradigm shift occurred. Medical professionals and researchers began to understand substance abuse as a disease, a chronic yet treatable condition. This new perspective heralded a transformation in treatment approaches. The advent of the 21st century brought with it a wave of innovation and progress in substance abuse treatment. Harm reduction strategies began to gain traction. These strategies, such as needle exchange programs and supervised consumption sites, aimed at reducing the negative consequences associated with drug use, rather than focusing solely on cessation. This approach recognized the complex nature of substance abuse and the reality that recovery is a process, often fraught with setbacks. In the past decade, the focus has shifted even further towards individualized care. Recognizing that each person's journey with substance abuse is unique, treatment plans began to be tailored to the individual's needs. This approach acknowledges the multitude of factors that contribute to substance abuse, including genetics, environment, and past trauma. The importance of addressing mental health in conjunction with substance abuse has also been increasingly recognized. The concept of dual diagnosis, where a person is treated for both their substance abuse and any underlying mental health conditions, has become a critical part of many treatment programs. In recent years, the opioid epidemic has posed unique challenges. The alarming potency of drugs like fentanyl has necessitated alterations in treatment approaches, including debates about higher dose formulations of naloxone, an opioid antagonist used to reverse overdoses. Indeed, the past 30 years have seen a remarkable shift in our approach to substance abuse treatment. From viewing substance abuse as a moral failing to understanding it as a disease, from punitive measures to harm reduction and individualized care, we have come a long way in our efforts to help those struggling with addiction. Let's journey through the timeline of significant events that have shaped substance abuse treatment in the last 30 years. The early 90s marked a significant shift in substance abuse treatment, with the liberal prescribing of opioid analgesics leading to widespread availability and diversion. This period saw many individuals transitioning from prescription opioids to more dangerous substances like heroin, due to its cheaper cost and increasing purity. The rise in heroin-related overdose deaths by 2010 was a wake-up call, prompting increased funding for research and treatment. A significant breakthrough came with the introduction of medication-assisted treatments. One such medication, naloxone, an opioid antagonist, was widely used to reverse overdoses. However, the influx of illicitly manufactured fentanyl, a substance 50 times more potent than heroin, presented new challenges as naloxone was found to be less effective against it. The early 2010s saw advancements in behavioral therapies, offering a more comprehensive approach to substance abuse treatment. Cognitive behavioral therapy, for instance, started gaining traction, helping individuals understand the triggers of substance use and equipping them with coping strategies to prevent relapse. The rise of peer support programs around the mid-20s marked another milestone. These programs provided a supportive community for individuals in recovery, fostering a sense of belonging and encouraging the sharing of personal experiences and coping strategies. Policy changes have also significantly impacted substance abuse treatment. For instance, the increased accessibility of the overdose reversal drug Narcan has been a result of public awareness and advocacy. However, the fear of potent substances like fentanyl has sparked debates about the need for higher dose formulations and the potential for punitive legislation. Finally, the role of non-profit organizations in bridging information gaps and providing unbiased resources cannot be overstated. They have been instrumental in changing the language used to describe addiction, thereby reducing stigma and improving access to care. These milestones have not only revolutionized treatment strategies, but have also fostered a broader understanding of substance abuse. To sum up our discussion, the past 30 years have seen a significant shift in understanding substance abuse. We've moved from viewing it as a moral failing to recognizing it as a chronic disease that requires ongoing, individualized treatment. Just as each person's journey into addiction is unique, so too should their journey to recovery be. We've seen the rise of harm reduction strategies, acknowledging that complete abstinence may not always be a realistic goal, and that reducing harm is a valid and beneficial approach. The introduction of medications like naloxone and buprenorphine has revolutionized treatment, providing life-saving interventions and supporting long-term recovery. Policy changes have also played a key role, both positively and negatively. While increased funding for research and treatment has been beneficial, punitive legislation, particularly in response to the fentanyl crisis, may not be the most effective solution. Lastly, the importance of reducing stigma cannot be overstated. Language matters. Reframing addiction as a health issue, not a character flaw, can improve access to care and support recovery. As we continue to evolve our understanding of substance abuse, it is imperative to keep advocating for evidence-based treatments and policies that prioritize the health and well-being of individuals struggling with substance abuse.